COPD.
All right.
It's an immune disease and it has a different course of action. It's not really COPD.
All right. So, well, then we can probably take this question when sometime we are discussing his condition. Well, I think it's just appropriate time for us to slip into another break, but do come back quickly, as now we'll tell you as to how severe can this disease get and what is the treatment required in that stage. So don't go away, as we'll be back very quickly. Welcome back. You're watching Healthy India, and today we are talking about COPD. So if you still have a question that's lurking somewhere in your mind, please pick up your phone and dial 1800115313 and 23035420. Well, as I promised you that we'll be telling you now about the severe condition of COPD and how that can be managed. So I'll request you, Dr. Menon, to tell us a little bit as to what does this severe condition really look like to a common man.
Okay, the severe condition of COPD usually would mean that the patient is very severely breathless. He's cyanosed, that means there's bluishness of the hands, and there are some blood criteria which have to be tested out in the hospital, where the blood oxygenation level falls below 60 and probably the carbon dioxide levels go up. So this involves admission into a hospital, maybe into an intensive care unit.
Correct.
And a variety of drugs have to be used in such a case. A majority of such patients would be on inhaled long-acting bronchodilators, what we call LABAs, along with some anticholinergics. And apart from that, a number of other measures, including oxygenation, is very important because we have to give oxygen from outside.
Correct.
In the most severe of cases, where the lungs are severely damaged, there are options of even using non-invasive ventilators, which is what would be used in the treatment of COPD. And the most severe, of course, would have to go on invasive ventilation, where they're admitted into an ICU for that reason.
Right. Now, Dr. Usha, talking of managing this disease, now in the market if you go, you do find, you know, air humidifiers and all that, and they say that these are very good for people who are suffering of COPD, as it, you know, helps to kind of clear the air and all that. So is that really required, or is it just a gimmick?
It's basically the disease of pollution or disease of the smoke. And in India, there's a pollution.
Correct.
In India, there's a lot of smoke because of our lifestyle, our cooking style, other things. So, and in India, another thing is the weathers in between become very dry. Maybe that is the reason we are prone to getting infections. And once there are infections, that's the time it flares up. And that's the time a person realizes, like, I'm suffering. Otherwise, they are used to that kind of a compromise, pulmonary function. So that's the reason many people, like in a house, also say, if you're having infection, take steam. So that means give a humid atmosphere. But it's not really a cure for it. It's a dry weather. That's why some of the people are advising, okay, take a humid kind of a humid oxygen or a kind of mist. Exactly, truly speaking, is the disease of the smoke, and better avoid that rather than taking. Yes, you can keep some oxygen if required, if that is also moderate to severe. But that oxygen should not be taken dry, it should be taken humidified. Because dryness can again produce kind of inflammation inside.
All right. So what else should be done to manage this condition, Dr. Rahera?
You know, the management, basically there is a plan depending on the symptoms,
Stage.
mild, moderate or severe. If the patient is having severe COPD symptoms, as Dr. Menon told, go to the hospital. Patients need admission. Maybe, you know, what have we talked about? The patient needs oxygen, then long-acting beta-2 agonist, anticholinergics, bronchodilators, and some IV medications also. And in the mild to moderate form, the person at home should be given a plan by the doctor, by the physician, that see, these are your symptoms. You have to understand when they are getting worse and when you have to seek the doctor's advice. And once you have this, they can just step up their bronchodilator therapy at home. They can do other better things in the form of avoiding that irritant or pollution in the environment, making them stress free. And preventive aspect of the disease is very, very important. If you are having a COPD, you should always take care that you have a proper pneumococcal vaccine once in a lifetime. You are taking influenza vaccine every year, which comes in the month of September, October with new strains. Because, you know, 50% of the acute exacerbations in COPD patients are because of the infections. And if we can take care of that, it will really give